Hello, good afternoon, everyone. We would like to thank you for your attendance, to all our congressmen and women, and especially to our members of the Presidium. It is a great pleasure that we were finally able to conduct this first Congress of Primary Care Pediatrics, Excellence and Warmth in Favor of Childhood, conducted by United Doctors, Medical Fraternity for Health, and the Mexican Academy of Pediatrics. It has been a large interest for all the groups, the primary health care of children and teenagers, as well as public health, and improve their health in all sectors and in all fields for children's care, not only from the medical perspective, but also socially and emotionally. It is a great pleasure to introduce our members of the Presidium, and I would like to thank the attendance of Dr. José Carlos Alcocer Varela, Secretary of Health in Mexico. We also would like to thank and welcome Dr. Moira A. Szilagyi, who has been voted American Academy of Pediatrics President-elect. She has been very interested and she's been following the organization of this event. It's also a great pleasure to welcome Dr. José Halabe Cherem, President of the National Academy of Medicine. Big acknowledge for his support on conducting this Congress. Dr. Roberto Calva Rodríguez, President of the Mexican Academy of Pediatrics, term 2019-2021, and special acknowledgement and we would like to thank you, Dr. Blanca Aurora Hernández Cruz, Director of the Health Science School at University of Valle de Mexico. She has given us the academic validity for this Congress. And finally, but not least important, because he has been the soul of this Congress and he has devoted a lot of time, enthusiasm, and energy in order to have a high academic level Congress by choosing topics and speakers to Dr. Eduardo Antonio Lara Pérez, Executive President of the Congress and President of United Doctors. Now, we would like to pass the floor to Dr. Eduardo Lara Pérez for some welcoming words. Thank you very much, Dr. Alicia Elizabeth Robledo Galván, VP for the Mexican Academy of Pediatrics. Hello, good morning, and thank you very much for your attendance, Dr. Jorge Carlos Alcocer Varela, Dr. Moira A. Szilagyi, Dr. Roberto Calva Rodríguez, Dr. José Halabe Cherem, Dr. Blanca Aurora Hernández Cruz, dear professors, steering committee, and congressmen and women. 18 months ago, the world changed after the pandemic of COVID-19. Everything we knew so far changed drastically, producing a huge impact in the health services, hospitals, and producing in the general population repercussions in their way of living, economically, socially, educationally, and producing high rates of mortality. Where we can highlight comorbidities due to the lack of early chronic diseases detection, the lack of management and disease control that facilitated the vulnerability in this group of the population. Medical Fraternity for Health and United Doctors were concerned about addressing children's care to improve the development and the prevention of diseases and the improvement of public health, had the idea to make a bet in the update and to propose the knowledge and to get the necessary competences in the primary health care and out of hospital care. Today, we are starting with primary care pediatrics by trying to address these needs of information that most of the time have not been addressed by the School of Medicine, by preparing doctors for primary care. And in the case of the specialties that have been developed in hospital areas for secondary and tertiary care, do not completely cover primary care, which represents 80% of the demand for children's care. I feel very proud and very honored for having these members of the Presidium and to have been put together these speakers for the organization of this Congress, all of them being very generously by sharing the most of them. Thank you to the congressmen and women, and I hope your expectations are covered. Thank you very much, Dr. Lara. Now we would like to ask Dr. Roberto Calva Rodríguez, President of the Mexican Academy of Pediatrics, to address the message to the audience. Hello, good morning, everyone, and thank you very much. I would like to send my regards to all the members of the Presidium and to all the personalities that have joined us in this morning. I really would like to show my appreciation to Dr. Lara for putting together this amazing program in this Congress. Primary health care is one of the most important things part of the health system, and due to its characteristics and importance should constitute the foundation of the health system. The World Health Organization defines it as the sanitary essential and access of health to all members of the communities through the means that are accepted by them with their whole participation and in an affordable cost for the community and the country. It is the access of the health system of the country, and it is an integrated part of the social economical development of the community. We can say that thanks to its existence and the polyvalence provides an existence which objective is to address frequent health issues in the individuals and their communities, coordinating with whatever is necessary with the rest of the existing levels and social and sanitary devices. Primary health care is characterized by a series of attributes or principles that define it, and that at the same time is the source of their importance. Its four elements are accessibility, to ensure proximity and timely access to health facilities; longitudinality, care professionals accompanying patients over time; integrity or polyvalence, individuals who require care from a biopsychosocial care approach; coordination with other specialties and different levels of care. Countries with a primary health care have lower costs, a healthier population, and they contribute to the reduction of inequalities among the different groups of population as defined by the Pan American Health Organization. A health system based on the primary health care orientates its efforts to the values of equity and social equality, and for individuals to have the highest health level without distinction of race, political ideology, or social or economical situation. Therefore, primary health care is the global strategy to improve health in the communities. It must be across strategy, including the health sector, but that it also involves other social aspects such as social security and education, etc. And this does not depend on health professionals, but the contribution of different disciplines and firm political decisions. One of the fundamental objectives is to improve the health of the less favorable communities by searching equality in the access of care as well as a better efficiency in the provision of services. Primary health care doctors are the family doctors that have been there forever, that are caring for these families in all environments where they can get sick, physical, psychologically, and even those that are produced due to the social sphere. Our care is longitudinal. This means that we know the patients from the time they were born and as they grow up, as well as the rest of the family. In the primary health care, we bear in mind the most determinant attributes of health, and we focus in those aspects that are related to physical, mental, social health, and well-being. With this, we can offer an integrated care for the health needs during the course of life, and not only for a specific set of diseases. Primary health care ensures individuals a high quality care from promotion, prevention, all the way to the treatment, the rehabilitation, and the palliative cares for terminal patients, and all these as close as possible from their hometown. These primary health care also includes other benefits, such as mental health care in coordination with the specialist services and dental health as well. At least 3.6 billion people, which is half of the world population, still without having access to essential health services. And addressing primary health care in low to medium income countries could save over 60 million lives and to increase life expectancy in a 3.7 points by 2030. In the high-level meeting of the General Assembly of the United Nations celebrated in 2019, countries committed to reinforce primary health care. The World Health Organization recommends to all countries to increase budget for the primary health care in 1% of the GDP from financing sources from the government or even external or both. In this context, pediatricians are fundamental engines for children and adolescents' health because it is the first healthcare specialist to address 90% of the attention demands in the pediatric age. Essentially, due to its activity as an advocate, promoter, and inspiring an educational role in vulnerable groups and their families. The Mexican Academy of Pediatrics has given its academy validity to the Mexican Magazine of Primary Care Pediatrics, led by Ulises Reyes Gomez, which allows the dissemination of scientific information in the field of pediatrics. The Mexican Academy of Pediatrics will continue its contribution in the public agenda to continue with its role as consultant of the Ministry of Health and to reinforce all the action in the field of primary health care. Thank you very much. Thank you, Dr. Calva. Dr. Moira A. Szilagyi, thank you for being here with us. We have been your interest for all the common topics for our children, and not only for each one of our countries, but worldwide. And we would like you to address a message to the audience. Gracias a la doctora Alicia Elizabeth Robledo Galván. Muchas gracias a la Academia Mexicana de Pediatría por organizar este evento y agradezco a todos los que están el día de hoy con nosotros. Es un gran honor participar en el primer congreso virtual organizado por Médicos Unidos por México y estar aquí junto a las grandes mentes de la pediatría. Como médicos de pediatría, compartimos tanto la pasión a la medicina y al ayudar a los niños. A través de estos vínculos en común, tenemos la fortaleza para estar en conjunto, aún lo hagamos de forma virtual. Como ustedes lo saben, la salud de los niños está influenciada por muchos factores, cómo viven, cómo aprenden y la fortaleza que tienen en sus comunidades. Esto también nos ayuda a pensar que es importante para promover la salud lo que sucede fuera del hospital y poder prevenir enfermedades. Nosotros como pediatras tenemos una gran responsabilidad de promover una cultura de salud, incluyendo un mundo más saludable para que los niños crezcan. Yo he practicado la pediatría por más de 3 décadas, pero todos los días me emociona ir al trabajo porque cada paciente está lleno de posibilidades. Trabajamos en estos momentos, pero también con el reconocimiento de cada uno de estos momentos nos ayuda a un futuro mejor y que ayuda a la trayectoria de un niño de por vida. Somos privilegiados de tener este vínculo para hacia el futuro y ayudar a estos niños a que sean todo lo que quieren ser. Es ese sentimiento de esperanza que nos caracteriza a nosotros como pediatras y nos reúne en este congreso, en un solo lugar donde nos podamos convivir, aunque estoy muy emocionada de que pronto lo hagamos en persona. Los próximos 3 días van a ser muy emocionantes y educativos. Estoy ansiosa de aprender de ustedes y de aprender también de los temas más importantes de pediatría de nuestros tiempos para que sea a nombre de los niños a los que atendemos. Thank you very much, Dr. Moira. Dr. Jorge Carlos Alcocer Varela, it's a great honor to have you here this afternoon. It's a great privilege. And knowing that we have put together with efforts to serve our children better, we would like to ask you to start with the inauguration. But before that, please address a message. And we really, really appreciate your message. Thank you very much. Good afternoon. Dr. Roberto Calva Rodríguez, President of the Mexican Academy of Pediatrics, Dr. Alicia Elizabeth Robledo Galván, Dr. Eduardo Antonio Lara Pérez, thank you to you all for making this Congress possible. Thank you for receiving me virtually. It's a great honor for me to be here today with you. Dear Academy, the historical time that we are living in our country requires better pediatric attitude by facing the pessimism of the inertia. In words of Gramsci, the optimism of wellness. It's where utopia is coming very strongly, where we combine our intellectual, and these allow us to have a health system that is not enclosure in medicine in a hospital approach, but that is also prioritizing the formation, education of physicians capable of promoting health and to prevent diseases. Saying that we are ensuring a primary health care for our children and adolescents after COVID-19 is one of the lessons that we must learn in order to walk towards the correct path. Which one? The one that we have had very clear since the beginning. Even though we are comfortable to say that COVID-19 has less possibility of causing severe damage to children, we must be aware of the social and psychological and affective impacts caused by COVID-19 in our children, especially for unfavorable families that are supporting in their shoulders the consequences of the crisis that the world has fallen into. We understand that youngsters suffer these consequences different from the rest of us, and it is now clear that the lockdown impacts in mental health, the increasing number of abuse of children in their homes due to the measures of lockdown and not meeting their friends and to avoid physical contact, we will definitely have future impact in the physical and mental development of our children. In the COVID world, we have to think about those things that will help us to make a change in our children's health based on a primary health care model, which is the central topic of this Congress. We must provide free access to physical and mental health care for those children and adolescents that have suffered from the pandemic, to have adapted places which will allow us to provide preventive care that will address the specific needs of these group of age. We need to be capable to provide children with the support and psychological treatment so we can do all these on time. And also education in health that should go beyond the borders and to reach all communities. Primary health care, as it has been mentioned before, it is a must in order to allow the population to have happy and healthy children and adolescents, especially for those vulnerable groups. Our objective is to increase the number of children with full vaccination schemes and to avoid obesity in this population, and not to forget the social health and the services they receive. We are aware of the big challenges we're facing, but we are now, more than ever, we're claiming for a better care for this group of age. And I would like to highlight the adverse impact of COVID-19 will go even deeper if the healthcare is also compromised. Therefore, we must not forget to invest in the care of our children, because it is in them the responsibility to contribute in avoiding another crisis, same or even bigger than the one we're currently living. Nothing can be achieved without the support of the medical field, especially the Mexican Academy of Pediatricians, that since it was founded has been contributing to the Mexican health, and that it is now present through this international congress due to its excellence and warmth in favor of childhood. So this is the time where we need to incorporate the whole health sector, where all of us, all health professionals, need to engage in the collective issue solutions. This is a live process that by definition it's transformational, that we should always include the medical field, and that understand that inequalities in health are real as far as we live our health in under a market logic, which understands that collectively it's better for us and the struggle against corruption is the best. That we no longer have sad and corrupted authorities. We need to move forward together, that it comes from from not doing anything and to improve much better things. Dear colleagues, this is how we like looking at the Mexican Academy of Pediatrics among heroes, freer and more aware. We need to guarantee the timely stay of health for children and adolescents. Nowadays, all physicians are looking towards hope. We work together, and this is what we're doing with the firm conviction that we're feeling accompanied by you and our population. Thank you very much. Thank you, Dr. Jorge Alcocer Varela. And with this, we end our inauguration ceremony. Thank you to our members of the Presidium, congressmen and women. And hopefully you can continue with us with the rest of the academic sessions and the following days as well. Thank you to you all, and the success of this Congress is all for you. Thank you very much and have a great afternoon.